Welcome, everybody, to another edition of Spotlight on Addiction. I'm Scott Jones with Duchess Raufman, and we're going to be doing a regular thing here because the last time we did our thing, people liked it.
They totally loved us.
And,
Had to bring it back.
and you and I always have fun hanging out anyway, so
Yeah,
get away from all the other crazy people in our lives.
absolutely.
There's a lot.
It's a lot.
It's a lot. But but here we get to talk about things that we've experienced and things that we've worked with and things that we've seen out in the industry in addiction and mental health and everything else, and try to just put a little bit more of a human spin on it. We certainly could talk about some real highfalutin, complicated things and everything else, but let's break it down for what normal people need to be looking at, what normal people see every day, and these are our opinions. These are things that we see in our ideas on them. It doesn't mean that it's right. It's not gospel. But take it for what it's worth. And if you like this, then contact us. You can get a hold of us through the Duchess.
The Raufman Group.
The Raufman Group. Or you can go to atceducation.com. You can get in touch with us and let us know what you'd like us to talk about if you've got questions about addiction, the addiction industry, and treatment, and staying sober, of course.
Absolutely.
But today, one of the things we wanted to talk about, and we touched on it briefly the last show we did, was this repetitive nature. I know we're jumping right into it, guys,
Yeah.
but we have to
Yeah.
because this is big. It's not, and I know it's frustrating for parents and family and insurance companies and everybody else. There's this like revolving door on treatment centers now especially for some of the younger clients, where they're in and then they're out, and then they're in and then they're out. And we're talking about 17, 18, 19 times in just like 2 years.
Yeah.
In and out of treatment.
Well, it's the what is the fight or flight method when it comes to treatment, kind of, because they will enroll into one treatment center, like it for 1 or 2 days, and then somehow they'll find out about another treatment center and decide, you know what, I want to go there because guess what? They serve hamburgers on Friday. So, of course, there's someone who's not really committed to their recovering process, and it really is an issue. It happens a lot. And another thing that a lot of facilities do, that I've seen countless times, is that bringing the same person back again.
Right. They're bringing them in and giving them the exact same treatment modality that they had before.
Right.
I mean, folks, come on. If you take your car to get it fixed and you go back to the mechanic, maybe you go back a second time. But you go back 3-4 times and you're going back to get the same problem fixed, you deserve to get screwed. I mean, really?
Yeah.
Why would you keep going back?
Well, right. So I'm all for 2 times. I think 2 times is a willingness to say, you know what, the first time I wasn't ready. The second time I'm committed. I had a great therapist, but however, my addiction was bigger than anything and I wasn't committed. So if you're continuously going back to that center and you have 4 charts of that in a 6-month period, that's a problem. And I have a lot of friends who do utilization review, and they tell me all the time, the case manager knows that case, and they know how many times that patient has been to detoxes, inpatients, day night with community housing, intensive outpatient. They have like a whole laundry list. I remember filling in for a friend of mine at his UR company, and I was doing a review, and they was like, listen, I'm giving you 4 days of treatment for this client. That's it. They've been in treatment the entire year. I've been starting this. Like, enough. Outpatient, get it together, and it's out. It's very sad.
It's terrible. And, I mean, there's so many different sides to this, but we started on the treatment side, so let's talk about that. Mm-hmm. It's almost as if, well, certainly there's some treatment centers, we're not going to sugarcoat it. Some of them are very bad places. They really are. Mm-hmm. They're concerned more about the money that they're going to make than the clients that they're going to help. You have to be concerned about making money so you can keep your doors open.
Right, it's a business.
But
let's not forget that. It is a business.
Your business is saving lives. And if what you're doing is not congruent with that,
right,
you shouldn't be in the business. Mm-hmm. So it's about the money. So they'll bring them back no matter what. As long as the insurance is going to pay, we're going to bring them in. It's not about whether they can actually help them. And that's kind of like one of the attitudes that's been adopted by a lot of places. Is that an issue?
It's definitely an issue, and it's definitely becoming quite visible to not only at the state level when they were doing their audit, but also at the accreditation level. So say, for example, if they're doing something called a tracer, which is basically a tracer of the chart from the very beginning to the pre-admission to the end, and they'll see this client wasn't a good candidate for this treatment center.
Right.
Right. So say, for example, if your facility is known for just straight substance abuse, and this file is completely filled with mental health Baker Acts, unable to sustain medication, in and out of treatment, and you're an open door facility and you have no mental health professionals on your team, then that's a problem.
Yeah.
And then that's when you have the repetitive of the client coming in and out. And then it's like, why did you accept this client in the first place? The pre-assessment was very clear.
Yeah.
That it should have been a referral to another agency.
And more importantly, if you do have these clients coming back in and out, if you're going to take them back, even for just a second time,
Stabilization.
you have to show that you're changing your approach.
Absolutely.
You cannot put them with the
Yeah.
same therapist on the same modalities and the same track. You've got to, if you bring somebody back and say, listen, we didn't catch the anger there. We didn't catch the trauma.
Oh, yeah.
But so now when they're coming back this time, you know what? We're going to address that. They have to start doing that.
Oh,
and
absolutely.
And many of them, most of them don't.
No. So there's something called a psychosocial assessment that has to be completed. And in the assessment, think of it's like your life story in 7 pages. And they ask you anything, everything possible. Okay, maybe the first time when you came to treatment, you wasn't ready to divulge that there was some sort of sexual abuse.
Sure.
Some serious trauma. A big thing that people aren't, I mean, it's all in the news, but human trafficking is really big. And not only with females, but also with males, which I came to aware of it.
It's shocking, isn't it?
It's very shocking.
Yes.
Yes. So that's another thing. And so you decide this go around, I want to talk about that because I had shame and guilt around
Right.
it. I'm ready. Okay. This is the reason why this is the reason why I had to leave home because of this. Great. But don't pair them with the person who is clearly someone who just does mindfulness and meditation.
Yeah.
That's not gonna possibly.
That's not
help the
gonna do
person.
it.
You need a trauma specialist at that point, someone who's definitely has some extensive trauma experience, and not someone who just took a weekend course to fulfill their CEU. I'm just saying.
No, you're right though.
just
You're
saying.
right. You need, if you're going to have a
Yeah.
specialist, have somebody who's truly trained.
Yeah.
But we see this all the time, and they're not addressing these issues. And when I'm not saying give up on anybody, I'm never saying that.
No, absolutely not.
But I'm saying if somebody comes through your door and they're coming through the door for the 3rd time or the 4th time, and if you're taking them back with no new information and no new plan,
Right.
send them somewhere else.
Yeah.
I mean, we have a responsibility in this business to do that. We don't always make the choices that are going to make us the most money. If you do things the right way, you're going to be okay, but you got to make the choices that are the right thing for the client.
Absolutely. I think it's essential that we look at everything, right? And what I mean by that, mind, body, and soul.
Yeah.
Right? And I never understood this. So we have insurance payer standards, and of course we have our state standards, and then we have our accreditation standards that we have to complete documentation within a certain amount of time. And I never understood the logic of trying to capture in detox when you're literally just coming off, the street or home. You're still, have drugs in your system, and I'm going to ask you the most personal things possible while you're literally unable.
You're still shaking.
You're shaking and you're nodding out on the table. Okay.
It's like, talk to me about your
Talk
childhood,
to me.
right?
Talk to me. And I just think that
Yeah.
it makes you're signing consent forms that you don't. I have clients come back, I signed that.
Yeah, they don't remember doing
They
that.
don't remember. I think it's something. I think that especially for detox and inpatient residential, I think it should be at least a 24-hour period where you're signing documents.
You need the basic consent for treatment. You need your basic consent to treatment.
Medication.
Consent for divulging
do.
medical.
Yeah.
But then when it gets to all the other stuff, you really got to take it easy.
Yes, absolutely.
I mean, we expect people to function at a high level when they're coming in the lowest point of their life.
The lowest.
And it's so there's a lot of things that are screwed up, not just with the treatment centers, but with the system itself.
Oh my God.
And with the we've got conflicting. You just said it. when you were working in a treatment center, you're looking at, okay, what does the state require me to do? Okay,
Correct.
now what does the insurance company require me
Correct.
to do so I'll get paid? Now, what is the accrediting body, whether it's CARF or Joint Commission
Correct.
or whatever else you may be involved with, whatever other places. Now you've got one piece of paper that you got to fill out, and you got 3 different entities telling you how to fill it out, and it's not always congruent. It's not always the same. Some are saying you got to do this in the first 10 hours. Some are saying you can do it in the first 10 days. It's a mess.
Yeah.
And I think this is one of the problems we have, is that there's no uniformity of treatment care and how it should run.
But you have to also understand, and I was having this conversation with a colleague of mine. I've been doing this like 21 years now, and I am not seeing the same addict that I saw when I first got out of college, graduate school. It's a totally different.
Well, look at you. It was, what, 3 years ago you
Thank
got out
you.
of school?
Oh, thank you, Scott. Thank you.
She's so easy. She's so easy.
No, but
you're right. It's different.
It's different, right? So you would get the alcoholic, and I lost my job, and I need to get back home to my wife, right?
Mm-hmm. Yeah.
That's not the demographic is totally different.
Yeah.
You're getting the 19-year-old who is so treatment savvy, they can tell you the ins and outs of treatment, what their policy pays, what drugs they've been taking for the past 3 days. Ugh. And you're like, wait, what? You just don't do alcohol? You do fentanyl? You do opiates?
When the client coming in has more experience in addiction care than the provider, that's not good.
Yes, but that's
what we're seeing.
That's what you're seeing, but the laws are still the same.
And the risk is higher, too, by the way, because of the drugs that we're seeing.
Mm-hmm.
I mean, back in the day, if you were dropping acid, you were a real addict and you were really doing the bad stuff.
Oh, no.
Now we got stuff that'll eat your face off. And, we've got fentanyl, with crocodile, all the other ones that we can go on with. What was the one that had the people...
the bath salts?
Flocka.
Yeah, that was another thing. So
these are horrible, horrible things.
Mm-hmm. But you want me to sit them down, complete an assessment, right? Within 72 hours to call it into the insurance company to make sure that I can get some service days or be allowed. This is for insurance. Of course, if it's self-pay, it's the same requirements, but it's just impossible. It's very hard, especially if the patient is not committed to wanting to be in treatment and they have ulterior motives. Like, okay, I need to rest up, right? I've been on a run for a week. I'm tired. I want to rest in order to go back out. And that's another thing that's happening.
Yeah. My girlfriend threw me out. I need a place. My parents threw me out. I need a place. And then they got this credit card. It's called an insurance card. They use it like a credit card. They just walk up. They say, do you accept this card? Good. I'll come and stay with you for a while.
Right.
And then even if they make it all the way through treatment, there's a problem is that, and I'm going to put it out there, this direct blame on treatment centers and some individuals, that they teach clients that relapse is a part of recovery. They use that statement a lot. Relapse is part of recovery. It happens. Why are we making that acceptable? The moment you tell an addict or an alcoholic that it's acceptable to relapse, and it might be what they have to do, they're going to take that and run with it. I say relapse, it might be part of your story, but it is not part of recovery. It's an abandonment of recovery. Mm-hmm. I don't condemn people who relapse, but I certainly don't give them the green light to go do it. And I think some places do it because there are places, and you and I know them, and we've been those places, where they kind of hang their hat on how many people they can bring back.
Yeah, it's really unfortunate. It does happen. I've been on the other side as a clinician, and to see that my patients that I know I worked really hard for with them, to get to that point of like, okay, I have 30 days. This is the most I've ever had. And then somehow, life happens and they relapse. But the problem is, it's for them, it's 10 times worse. Right?
Yeah.
That relapse has now cost them, it could be their license, their children, their jobs, the ability to be gainfully employed. Sometimes they get a felony in the process.
Yeah.
And it's just unfortunate for them at that point. And they're like, well, all I could do is just pick up the pieces and get back. Yeah, you can. I'm not saying you cannot, but are you committed to doing it the right way this time?
Yeah. And I think that, I don't know, the more we talk about it, the more frustrated I get with it, because it is, when we're out there and we're trying to defeat something like cancer, you've got a lot of transparency and what are we looking for? We're all working together, and drug companies and research labs and hospitals and doctors are all working towards the same cause, and they find something that's working and they all get on board and they start saying, okay, let's get this. And in that, we've been able to, if not defeat cancer, at least we've made a dent and we've been able to arrest some forms of cancer and do things. We're not winning the battle on addiction. Why? Because the two rehabs next door to each other aren't working the same way. I mean, I'm not saying it has to be the exact same program, but it's got to be some sort of standardized, this is what works, let's all move towards that.
But unfortunately, like I said earlier, I mean, I agree with you to some extent. However, we're gonna argue. This is gonna get good. Totally fine.
This is gonna get good.
Care.
Just know that I'm right, because I got the on-off switch over here. No, go ahead.
No, it's for the simple fact that you don't see the rooms like you used to, right? As far as being able to go to a meeting. The meetings, they are, try to find one within a 10-mile radius.
Yeah.
They're not there anymore. So how do we now currently treat the patients that we have in a way to understand the big book, right? Some of them are like, I'm not doing that. I have my own method, whatever. Don't tell me.
Yeah, I've been in 12 rehabs. I got my own method.
Right. So you have these unique treatment centers that are popping up, and they're doing different things to attract to that patient. Okay, for some it does work. I'm not going to say that 100% is for everyone. For some it does.
Absolutely.
Ketamine may work for this patient. It may not work for Bob. Some people can do MJJ, marijuana maintenance. I want to say maintenance. Some people can, some cannot. I cannot discount it. I have to look at it globally.
Absolutely.
And that's just what it is currently.
And I'm not talking about everybody having the exact same program, but I'm talking about having some standards of care that must be met.
Oh, yeah. Okay.
And one of the ways to start that is by not having this huge disparity where an insurance company will pay this facility $5,000 and this facility $35,000. Because if they set up the standards of care, now, the other things that you add to your program that would attract certain people, some programs are better for younger people or better for men or better for women or whatever it might be. That's all good and fine. And, there could be some auxiliary services or something.
Right.
But there has to be standards of care that make sense to everybody. So to say, if you want to open up a rehab, you've got to follow these standards of care. Now, I know we try to do that with Joint Commission and CARF and everything else, but we fall way short. Because you walk into one place and you got people and all they're doing is teaching the 12 steps. There's nothing else of substance to their program, but they're getting paid at the same level as somebody who's using real medical staff and real. Do you follow what I'm saying?
Yes.
I think it has to have some sort of standardization to say this is the baseline of what we're paying for and what we need. Now, if you want to be good and to add other things, that's great for you. But we need a standardization that everybody will follow. And the first part of that has to be client care above all other things.
Yeah. But
here comes the but.
No, but it's very but it's very hard.
It's hard.
It's hard for, just say, for example, an organization that is just opening, right? And then needs to meet payroll and the standards of the building and have to get DCF if you're in Florida.
Right.
And have to get Joint Commission and have to get a pharmacy license. So they do have a standard of care that they have to abide by because the state level requirements and then of the accreditation. The ancillary stuff, the feel-good stuff that I like to call it, the brain mapping, the sound bath, the meditation, the yoga, that's good for some. For a certain clientele, that works for.
Absolutely.
However, if you have been diagnosed with conduct disorder from the age of 10, right? Now, I cannot put you in a meditation room.
No, I agree.
No,
with you.
I've seen it. Like I've seen. let's give him some, nutraceuticals, and it may work for a moment, 15 minutes or so. But guess what? He's
Yeah.
he's bouncing off the wall.
Yeah.
So for him, his treatment may be something different. So I like the part of a treatment center being a little more a la carte and looking at it like as if we were going to a spa and we were checking off certain things like, okay, you know what, Jack, you have PTSD, you were in the military, you need to work with a trauma specialist, right? For sure, hands down.
Right.
You probably need some brain mapping. Let's see if that works for you. Jessica, you've been having a lot of depression and your food habits are wrong. We need to make sure you see the nutritionist, do a food allergy testing to make sure you're okay and see what's going on. Could be triggering you physically and we don't even know. So I'm with
you. Listen, I'm with you 1,000%. I am.
Yeah.
I'm talking about a standard base level of care where everybody meets this criteria or you cannot be a rehab and care for clients. And it needs to be across the board and very clear and understood. This disparity between how many hours are we supposed to get and how much clinical care are we supposed to get each week, that needs to be a standardized
But
thing.
it is.
But technically it is, but then again, it moves from insurance company to insurance company and state to state, and there's different laws.
Right, it's different payer
We need
standards.
to if I want to open a hospital anywhere in the United States, I've got to meet certain standards. Now, I could become a hospital that specializes in heart care. And somebody could come to me and say they got a brain injury. Say, I'm not that hospital. I can't, I could stabilize you, but you got to go somewhere else for that. Mm-hmm. That's fine. That's what I'm talking about. Okay. Rehabs need to be treated the same way. Where if you're a rehab, the first responsibility you have is to client care at this level. Then you specialize in your other areas. And yes, you get paid for those services. But it's got to be very clear. I think we're missing the basic standard level of care. And I think that's where we fail. Okay. And there's, then again, we're asking people to turn around years and years of using in 28 days. Beyond that is absurd to begin with.
I will never forget I had a confrontation with one of my clinical therapists, and she was like, I don't understand. I've been asking Job, to delete his drug dealer's number and blah, 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 right? And I'm like, well, let's talk about it. Why, what's the reservation? And he said, this has been his friend for the past 10 years. It's like, I don't know what to do. I said, let me understand this correctly. You cannot not have your coffee for 24 hours without you spazzing out, right? Mm-hmm. So you're asking this person, Job, to delete his drug dealer's number. He's been here 72 hours. Why don't you commit to doing something that is a little difficult for you, and then you can understand what he's going through? I think sometimes clinicians get into this like authoritative mode where they need to understand like it's my way or the highway. No, you need to be a little more empathy here of what's happening with the patient and what they're going through, and not just trying to meet the deadline of a treatment plan or a UR review, and I think that should definitely change.
Absolutely. We're talking about something. It's not just, if it was just putting down a drink or a drug, easy. Lock them up for a little while and then send them on their way. But addiction, alcoholism, even some mental health disorders, it's so pervasive into every part of your life. Mm-hmm. You're not talking about changing one habit of picking up a drink or picking up a drug. You're talking about changing your perspective on almost everything you do, changing your routines, changing your friends, changing your daily habits and all those things, learning how to take care of yourself and shower and be responsible and get up and go to work.
Right.
We're talking about every area of their life has to be somewhat affected by this change.
Absolutely.
How the hell do you change someone's entire life in 28 days? Go to a gym and let them tell you could transform your body in 28 days. They're full of... Yeah, exactly.
Sign me up, I'm taking it.
Go to a weight loss clinic and tell them they'll make you svelte in 28 days. It's not going to happen. Go to college and say, are you going to learn how to be a lawyer in 28 days? Yeah. All you're doing is one thing, learning one skill.
Yeah.
You can't do it. Why do they expect that? And then these insurance companies get upset when these people keep going back.
Yeah, back again to the shuffle.
Maybe if you pay for it once and pay for it properly,
yes,
and give them the time to recover, you will cut down. There's always going to be a relapse somewhere. There's always going to be something going on. But it's ridiculous right now.
Yeah.
It's ridiculous because we're not all on the same page, and it's become normalized. Relapse is normalized. In fact, when I go teach at rehabs, when somebody tells me they've only been to one rehab, it's the only one they've been to,
wow.
I'm like shocked.
Yeah.
Because that's like the one person in the group of 20 this is their first time.
They're listening with the third eye.
It's crazy. It's crazy. What do we do?
Yeah. Well, I think it's the most important thing whenever you're picking your treatment center that you really look at what do I need to get out of it? What is my goal as if you're I want to say the parent or the spouse. If the person is struggling with an eating disorder, do not send them exclusively to a substance abuse treatment center. I wouldn't do it because we definitely need, if it's a severe eating disorder, we need to make sure that we are addressing that because, of course, you could die for that instantly, heart attack.
And you don't know, that may be the precipitator to the addiction itself.
Absolutely.
You don't know. You don't know, but you got to deal with it.
Yes, absolutely. I will also, once again, from the last episode, we talked about looking at the website, making sure that they're doing exactly what they're saying. The clinical staff, I will ask for a clinical schedule, to make sure. If you could
be specific.
Absolutely.
Be specific. If somebody suffered some abuse, bring that up and find out, how do you deal with this? We know this child has been abused most of their lives.
Yes.
How do you deal with this? If you've got a female that you're trying to help, daughter, wife, mother, friend, sister, and you know they've been sexually abused, do you think it's smart to put them into a place that's co-ed and that there are going to be guys, not because they're trying to take advantage of the situation, but just because when they're going through their stuff, some men act out sexually.
Oh, absolutely.
And that's going to be a real problem. So think about those things.
I think that's
there
a
are
very good
great
point.
places out there that are co-ed, but then there's many more that are singular, exclusive.
Yeah.
LGBTQ. If you've got somebody who's LGBTQ, don't just take their word for it. Say, "Oh, we're friendly, LGBTQ." Well, what does that mean? It means you say hi when they come in. What does that mean? Yeah, right?
They have the flag.
That's
it. But no one's on the staff.
We have rainbows on the cookies. It's wonderful.
Right. No, we need a little more than that.
It
needs to be a little more involvement in what under the operational level I think is essential. So I think we definitely covered.
You have to ask those questions if there's something specific. If you've got somebody who's pregnant.
Right.
There's a lot of treatment centers that are not equipped. There are some that are very specific towards helping. Now, I know Susan B. Anthony used to be the one, and they're not there anymore, unfortunately.
Yeah, I know.
But there are some other ones.
That's not really... You would definitely have to do your due diligence.
Yeah.
And because a lot of treatment centers would not take them past, or I'm going to say in the beginning stages, the first trimesters, where they will take them in the second trimester. And then there's facilities for us detoxes normally would not take. Definitely they'll say, no, they are not going to take them. I know hospitals were definitely running away from doing that as well. But I think it's essential. I need to see, do you have an OBGYN on staff? Is there a nurse practitioner on staff? Are we going to be able to see what is the doctor in a timely fashion? So there's a couple of things that has to be done, especially if you are pregnant.
And that's always a good question to ask is because a lot of times either mental but also physical ailments are not very apparent right at the beginning because people have not taken care of themselves and they're coming in and they're having some real physical problems. So make sure that when you're talking about a rehab, you ask about what do you do for medical services. Now, as far as I know, Bobby's doing good and he's fine, but we don't know if his liver's shot. We don't know what's happening.
Until blood work's
What
done.
kind of things do you do to make sure that they're physically okay? Ask those questions.
Yes.
Here's the thing, Duchess.
Yes.
People will research their goddamn cars more than they will research a rehab for their son or daughter.
I know, that's very true. They will spend hours and hours.
Weeks. They'll go test drive, and then they'll go back, and then they'll negotiate, and they'll talk, and then they want to talk to the owner, and then
I know. But it's you should take that same energy when you're trying to, pick out the drapes. that you are trying to find an appropriate treatment center for your son and daughter, or spouse, or yourself, right? So,
And they have a right to information.
absolutely.
If you call a place and they're like, well, we can't show you this or we can't talk about that, hang up the freaking phone.
Yeah.
You know, you don't want to be involved in places like that. Make sure, if you are involved in their lives, make sure they got a family program that's going to involve you as well. Because guess what? You need help too. And you need to know what's what so that when your loved one gets out, you're doing the right things as well, because you're going to have a responsibility.
Right. And that's very essential. The discharge plan. So when a client is getting ready to discharge, they have to have a discharge plan. It needs to be completed out. It needs to say a referral back home for if it's a practitioner, therapist, or if it's some medical problems that they have to address, if they're a Hep C and they need to continue to check their viral loads, or if it's some dental issues that they could not address. All of that has to be included with appointments and time.
It can't just be go to meetings.
No, 90 meetings in 90 days.
Yeah.
Right? No, unfortunately, that doesn't cut the discharge plan. No, right?
That could be the last line, but that's not what it's about.
And lately, because I still work at some treatment centers doing some consulting, they're asking for their labs. You know, I think it's important if you're going and you want to be able to take your lab work to your PCP. I think that's important, so they'll know what was, your levels, or what was your blood work, or guess what, they put me on blood pressure while I was in treatment, or maybe you don't need the clonidine anymore. Don't know, but you need to follow up, and I need to be a part of your discharge plan.
One last thing I want to mention about when you're looking for these things, and the discharge plan is huge, but there's also, and a lot of times people kind of ignore this, if you have specific religious beliefs.
Oh, yes.
There are many rehabs that, they're very open to whatever people want to do, but they do not supply, if you're devout Jewish or devout Catholic or something like that, and you want to go to services, find out if they do that, because there's a lot of them that don't, and not even always because they don't want to. Sometimes it just doesn't make sense for them to do it. Logistically, it's difficult. But if that's important to you, ask those questions ahead of time. And make sure that that's what they're going to do. But I see people get tripped up by that. They show up and they're like, well, I wanted to go to church on Sunday. Well, did you ask about that?
Right. Oh, we have a Christian track. And
we say God 3 times a day. That's the Christian track.
Yeah, right. So exactly, that's very essential. It's a very good point, because some people, or even their food, their diet, right?
Yeah.
If it's a residential treatment center and they're going to be providing services through a caterer, they need to know, right? Or if it's someone is a Muslim and they are fasting, it's Ramadan right now, so they need to be able to accommodate those things.
Absolutely.
Yeah.
Now, again, we're not asking. What we're not giving you permission to do is for people who are suffering from addiction to call up and just call the shots when they go somewhere.
No, I'm not.
I want to make sure I get steak and lobster every night. I want you to drive me to the movies twice a week. I want this. I want massages, and no. That's not what we're talking about. We're talking about the basic needs and understanding what somebody might need because of either cultural or family or tradition or habit or whatever. Those are important things.
Absolutely.
But this is all, it's just, there's so many things that have to change for this to get better. We're in the worst time ever. We know that the addiction rate is through the roof right now.
Right.
Like you said, you can't even find meetings anymore.
No.
Some places are open, a lot of places aren't. And for somebody to get out of rehab and have to go online to get their fellowship, that doesn't do that for many. Some people are good with that. Some of these kids, half their life's online.
Right, exactly.
So they're cool with it and they can make friends. But somebody like me, I need this.
Yeah.
I need togetherness. And so it's a tough time.
Yeah, it is. People are really on the edge, as we can see in media and what's happening in the news, and we just really need to address it. It's no longer can just be swept under the rug.
Yeah, it is. It is a tough time, and you don't have to take more than 2 or 3 steps to come across an issue that's just glaring right now.
Right.
Whether it's a race issue, whether it's the addiction, whether it's the virus, the gun control, what's going on in politics, and just the insanity of all of that. Our healthcare benefits and system is a mess. It's terrible. So the worst thing we can do is to keep participating in the badness and keep
Right.
participating in our own destruction.
Correct.
We need to help ourselves and help our loved ones
Yes.
get better.
Yes.
And information is
Education
the first
the key.
step. Yeah.
Educate yourself on the process. I think that's essential. I think it's one of the things that can help you not make the same mistakes all the time, I guess. What I'm
Yeah.
trying to say. It could just be that one time. I know a couple of people that went to treatment, got it the one time, and that was it. But they really sought out to that treatment center. They were ready, right?
Yeah.
So, yeah.
Here's the thing. Anybody can get clean and sober.
Yeah.
Once they decide that's really what they want to do.
Mm-hmm.
And I've seen people walk out of bare bones.
Mm-hmm.
I'm not going to bring them up specifically, but there's one city where they have a men's YMCA rehab, which is basically bare bones. You're sleeping in a gym on cots with a bunch of other people. You're getting your 3 meals. You're getting some help and everything else. And I've seen great people come out of there sober.
Yeah.
I've also seen people go off to Belize or somewhere fancy and
Yeah.
go with their massages and their personal chefs and and come back and drink on the plane ride home.
Yes. Yes.
So it really
Yes.
does all the bullshit we just said.
Yeah.
It still comes down to individual choice.
Yes. It does.
And I guess that's what makes this the hardest thing in the world,
Yeah.
because we could do everything we can do and we could straighten this all out, make it all right. It's still, we're not going to have a great success rate.
Yeah.
I wish it was different.
Oh, me too.
So now we're getting way too serious. We're going to have some fun.
Yes.
So we're going to keep doing this. We want to keep bringing this to you.
Yeah, we want to keep you informed, and if you have any questions or hot topic items that you would like us to discuss, because we're well versed in everything, no topic too shallow for me to talk about.
There we go. We'll go as low as you want us to go,
Exactly.
people. That's right. That's right. There's no shame here.
There's no shame.
We've got. Hey, listen, I used to lie in the gutter with vomit hanging from my beard. I mean, everything's fair game now. So, but right now we're part of Spotlight on Addiction. But I think by the time we get around to our next show, we will have our own title, our own show.
Yeah.
But we're born from this. But we'll be coming back and doing a lot more of this. Duchess, as
Thank
always,
you.
my
Aw.
queen. You
Yes.
are awesome.
Thank you.
Appreciate you coming over, and we appreciate you guys tuning in. We'll catch you next time on Spotlight on Addiction.